following is a tutorial to use the ReSPECT software to plan reverse total shoulder arthroplasty. In this tutorial, we will go over using each of the functionalities, including choosing your case name, planning your humerus, scapula, and range of motion. We will also go through the functionalities of saving a configuration of your implant, restoring that configuration, and submitting that information to Rehoboth Innovations for analysis and following prescription of proper placement of your implant for each patient. Now we start with File, where you can select from the cases that you have loaded. Today we have 2 different cases that are loaded, and by selecting a different case number, we allow the software to step through each of the patients that we're looking at. So now that we've selected a different case number, we correspondingly come down to the placement panel. Now you can either do the case selection from here, from File, or you can do it from manually here, from just case name, selecting Select. Currently 1517 is selected. We now move to the placement panel. The placement panel allows us to select allows us to select the sizes that we have to choose from for the humeral stem, as well as the cup differences that we have for the polyethylene insert. The stem, as you can see, is in blue, and the cup is in purple. And this is for the humerus. Beneath that, we have all 6 degrees of freedom for the humeral implant motion. So if we select, for instance, if we select an 8 millimeter thick stem with a poly insert that is 44 instead of 32, well, we go back to the 32, we can now left click on the viewing plane, which allows us to see the implant at all different degrees, all different viewpoints. We then can use our boxes here to look anterior posteriorly, to look superior inferiorly, to look medial laterally. And so that's what that allows us to now do is, if we slightly move around the implant, the view, we can now change the flexion we have with respect to the bone. We can change the version we have with respect to the bone. We can change the tilt of the implant with respect to the bone. And we can also change the medial lateral positioning of the implant. So correspondingly, we would like the implant to be within the bone. And we can superiorly or inferiorly place the implant. And we can correspondingly adjust the tilt to be more so that the 2 axes of the humerus long axis and the implant are aligned, and we can position it in the way we feel, and that is the best choice. Correspondingly, we can change the bone opacity, how see-through the bone is. So we can change it where we can see the bone or we can see the implant. We can change the implant's stem and cup opacity as well, if we wanted to see a little more what it's doing to the bone. From here, we make our choices on the humeral side. Once we're comfortable with that, we now move to the scapular side, and we look around, make sure we're comfortable. Say we're comfortable with this. It's down the long axis. We now move to the scapular side. Momentarily, the scapula will then appear. Now, correspondingly, we'll look at the scapula, move it around, think on, well, what would we like? Where would we want to position the glenosphere? Again, we can change the bone opacity, whatever makes us comfortable, where we can see see our glenoid vault and the spacing that we have. And correspondingly, we can change the version on the ball. We can change the tilt inferiorly or superiorly. We can change the flexion. It's not usually. We can change the medial lateral offset with respect to the glenoid vault. We can, so to make sure that it's flush, we can superiorly and inferiorly place it to avoid scapular notching inferiorly, and we can anteriorly, posteriorly place it to make sure we get the best use of our glenoid vault. So likewise, we can see if it's out of the vault or it's in the vault. Once we've gone through the humerus and the scapula, we now use the range of motion tabs to mate two surfaces, the cup and the ball, which will correspondingly cause us to move them a little out and inward and drop it down correspondingly. And likewise, when we have it mated where we want it, we would then just look at the internal and external rotation with respect to the ball. You can look at points of contact, and you can look at abduction with respect to the ball, and so on. So you can adjust it as you feel. And check out the fundamental ranges of motion. Upon finishing this, you can either save your configuration, which you can name it David configuration. Hit OK, and then you can likewise search for that configuration based on the patient and reload it. Or you can hit submit, where the information can be submitted to Rehoboth Innovations to correspondingly give you a muscle analysis and range of motion and impediment analysis of how the patient will perform. So you'll be able to have a prediction based on where you place the implant of how the person will perform after surgery, their range of motion and abduction, scaption, and internal and external rotation. This has been an overview for using the ReSPECT tool to plan a reverse total shoulder arthroplasty surgery. Please follow up with us, as we are currently in development of knee and hip planning softwares to plan total hip arthroplasty as well as total knee arthroplasty. Thank you so much, and follow up with us if you have any questions.